It's great to be here in a full room, I'll note. Not so long ago under COVID restrictions, these lunches were sort of 12 masked journalists, not a bread roll in sight. And Morris was doing his best, but it was a pretty sad state of affairs. COVID smashed, obviously, hospitality. It changed our lives. It locked us down. People couldn't get back into the country. Some people couldn't visit dying relatives. Hundreds of billions of dollars under debt. I don't need to go on. We know what it did. We still don't have a definitive report on what was worth it, why decisions were taken. And when asked about a Royal Commission, Anthony Albanese has said several times, and he's been in power a little while now, that we're dealing with COVID now and that's our priority. But experts say we could be dealing with it forever. So what sort of time frame are we really waiting for? What's the trigger? When will you be able to, your government be able to announce a Royal Commission on COVID?
Well, we said before the election and have said since that just given the enormous dislocation, stress, death and expenditure involved in this pandemic, it would be extraordinary not to have a very thorough inquiry into it, and that remains our position, particularly through the course of last year and summer, where there were significant waves that posed a lot of stress on health systems and communities. We didn't think that was the right time to announce that. We're giving consideration to this question. We'll have more to say about it in the future.
Our next question is from Sudan Levy.
Minister, you took us on a bit of a history tour in your speech. Sorry, I'm losing my voice as well, it's catching. You've decided to introduce a new My Medicare program as part of your reforms in the budget. This will allow wraparound care of people. When he was Prime Minister, Kevin Rudd introduced a program for diabetes patients that paid doctors $1,200 a year to provide wraparound care. Doctors wouldn't have a bar of it. It failed. The previous Health Minister, Greg Hunt, introduced healthcare homes. Same idea. Doctors were given a budget to provide wraparound care for patients. It also failed, and a review found it didn't actually improve patient outcomes. What is more magical about your solution, and how much is a doctor going to get paid to provide that wraparound care? What is the budget per patient under your program?
Well, as I said, the costings of that will become clear after next Tuesday night. I mean, I think the diabetes care pilot that we conducted when we were last in government had some very good results. It was agreed, I agree, it was contested at the time, and some of the different pilots that have taken place since, including the healthcare homes pilot conducted under the former government, also had mixed results. In the Strengthening Medicare Task Force, we looked very carefully at all of that. And we looked at the work that had been conducted to develop the 10-year primary care plan that was released in the former government's last budget. And there was, I think, a striking degree of consensus that is now built up around the need for some of these bundled or more flexible funding models to sit on top of fee-for-service. I think a much greater degree of consensus than there certainly was when we were last in government. So I'm confident we'll get the costings right. I'm confident, given the soundings we've had with AMA, with the College of GPs and many others besides, that there is a real appetite out there to step into this sort of new future for Medicare. It is a very different one, which is why I think it will take time to build. We're not in a rush to do it. We want to get it right because I think the Grattan Institute said that we've had more pilots than Qantas over the past 10 or 20 years, and they were right on that. And I think everyone's done with more pilots. I think we want to see some systemic change that's built at a steady, sure rate, learning as we go. I'm confident that's what we're doing.